Okay, let's get started with the introductions. I'd like to welcome everybody to our webinar today. This is our first webinar for World NTM Awareness Day, which is today, August 4th. Today's webinar is on mindful breathing and its potential benefits for symptom management. My name is Amy Lietman. I am the moderator today, and I'm the president of NTM Info and Research. It is my pleasure to welcome all of you here. Today, we are very pleased to welcome Dr. Sundar Balasubramanian from the Medical University of South Carolina. And I'm going to tell you all about him in there we go. Dr. Sundar Balasubramanian is a leading researcher in cancer biology and yoga, specializing in the application of breathing exercises, specifically pranayama, for improved health. He holds an associate professor position in the Department of Radiation Medicine at the Medical University of South Carolina and is the founder and director of the Prana Science Institute. Dr. Balasubramanian's groundbreaking research has established the first scientific link between salivary biomarkers and yogic breathing. His ongoing studies, funded by the National Institutes of Health, explore the potential of breathing practices to enhance well-being in various health conditions. These studies include the development and testing of a yogic breathing app for cancer survivors, the use of gentle yoga and pranayama for healthy aging, and the creation of a web portal dedicated to yogic breathing education. Dr. Balasubramanian's dedication extends beyond research. He has created practical tools to improve yogic breathing practices for a variety of populations, including employees seeking wellness improvement, cancer survivors, aging individuals, and those with scleroderma. In recognition of his exceptional contributions, Dr. Balasubramanian was named one of the world's top 5 breathwork experts by Mr. Feelgood magazine in 2023. We're very pleased to welcome you today. I'm going to give you a couple more announcements and then turn it over to you, Dr. Balasubramanian. I want to just take a moment to emphasize how important this topic is and how interested everybody's been in this, particularly since our conference back in May. So we're particularly excited to welcome you to this today. So as we go through the webinar today, you will see there's a Q&A button at the bottom. You can drop your questions in there once the presentation is done. You'll be able to ask questions. As a reminder, our speakers are not able to diagnose conditions, and they are not able to offer, input on your actual medical treatment specifically. So today's session will be limited to the topic at hand. Please remember that. We'd like to thank our sponsors for World NTM Awareness Day. It's thanks to the support of sponsors like these that we have been able to bring this fantastic programming to you. We're very excited that World NTM Awareness Day continues to grow in scope every year, and we're very excited to see where it takes us in the future. So thank you to all of our wonderful sponsors. And we'd also like to thank all of our partner organizations for helping us amplify the message. We're looking forward to having our message spread around the world faster than germs do. We are looking forward to helping to raise more awareness and accelerate the diagnosis process for patients who are suffering with NTM and bronchiectasis and who need speedier diagnosis to get better treatments. These are our other upcoming webinars that are coming along. We have Patients, Phages, and Progress, Building a New Paradigm for NTM on August 11th at 2 p.m. Of interest, one of the speakers is also a phage patient who was treated. And on August 28th at 2:30 Eastern, we have dipeptidyl peptidase 1, DPP1 inhibitors for bronchiectasis, an overview and question and answer period with Dr. Ann O'Donnell. Both of those are open for registration now, and we will be sending you those links if you haven't already found them. So be sure to register for those webinars as well. And Dr. Balasubramanian, I'm going to turn it over to you now, please. Thank you so much for joining us today, and we really look forward to hearing what you have to teach us.
Very good. Thank you so much. Hello, everyone. Thank you, Amy, for the introduction, and thanks the organizers, Helga, and everyone in the team. I hope all can hear me well, see me okay.
Yep,
Great.
we can.
Very nice. So as Amy mentioned, my name is Sundar Balasubramanian. I work in the Department of Radiation Medicine at MUSC. So NTM is one of the new topics for me. I'm specialized in breathing exercises and cancer survivorship and other symptoms, other diseases. But today, I'm very interested in sharing some of the things that we learned in other conditions and how you'll be able to use some of those information in your symptom management as well. So I thought I would have some slides, but I'm going to just talk, right? So the idea for me today is that to give you like 15-20 minutes of introduction theory and then go into practices. And if you have any questions, please feel free to use the chat box as Amy mentioned. So breathing exercises, almost every culture in the world have something to do with their breathing because it is powerful in terms of connecting the mind and the body. There is a lots and lots of things that you might have heard about taking a deep breath and watching the breathing. Mainly, I was interested in. I grew up in a tradition of yoga. That's where my earlier practices were, and I was having some keen interest on how these exercises or yoga practices in general work. So that's where my research started. As a biochemist, I wanted to connect what is the biochemical change that are created by breathing exercises. In 2013, we started some work based on my own experience with breathing exercises. So there are so many ancient traditional practices that are listed in the yoga tradition. I happened to come upon one of them from an ancient book called Tirumantram, which I use a lot in my research and my personal practice. And in that book, which has 3,000 poems, so that book has several exercises and information about breathing in general, or in general about the philosophy of yoga. So during my practice, I took just one exercise from that huge book. When I was following that specific exercise, it has a very gentle breath hold in it. So inhalation, breath hold, and exhalation. So when I was practicing it, witnessed there's more salivation. So I was having more saliva, more probably tears in my eyes. So I was wondering, like, why is this happening? So that's mainly because, as you probably know, the two responses in our body, the stress and the relaxation response. So the stress response is mostly you'll experience dry mouth, dry eyes, whereas the relaxation response is largely about moisture in your mouth and eyes. So I was interested in studying what are the different biochemicals that are expressed in the saliva in response to the breathing exercise. So that was our first experiment or clinical trial, so to speak, where we tested a group of people who were doing the breathing exercise and another group who were doing, kind of an activity, maybe a reading. So when we compared the saliva that was collected between those two groups, what we found was very interesting. We found molecules like the nerve growth factor, molecules that are involved in immune response, immunoglobulins, different types of immunoglobulins expressed in the mucosal surface. And then tumor suppressors, proteins that are involved in reducing the potential tumor at a later stage. And we also found proteins that are responsible for inflammation to be reduced. So these four major changes are very, very important in many diseases, not just in cancer. Let me repeat it again. So the first set of molecules is like important for the nervous system's function, proteins like nerve growth factor. And the proteins responsible for the immune response, proper immune response. And then also proteins that are needed for suppressing potential tumor formation, and proteins that are mediating inflammation are reduced. So this molecular change that happens in the saliva is a reflection of what might be happening in other areas of the body. So obviously, this is breathing exercises are very much used, or in the literature, there is a lot of evidence that it is used in COPD and in other conditions such as the reducing the psychosocial disorders. So people have shown that it has reduced depression and anxiety in many conditions. So following these initial findings, we were studying the effects of breathing exercises in many different target populations, including scleroderma, cancer, aging. Some of the recent studies that we have done show that in cancer, especially in breast cancer patients, after radiation treatment, when we gave this exercises for 12 weeks, what we found was they reduce these symptoms of anxiety and depression. We also showed there is a lot of changes in the biochemicals, in the salivary biochemicals, as I mentioned earlier. We also showed that it can be useful in scleroderma too, to improve the quality of life and also to change the biochemical markers in their saliva. So this is just, I wanted to summarize what we have known so far, how we can use some of the biomarkers, especially the salivary biomarkers, to monitor what happens after specific breathing exercises. There are so many exercises in the tradition. I have published books with 37 different breathing exercises, and it's called Mind Your Breathing, and also another book with 50 different practices. So the breathing exercises can be tailored for anything that you would like to address. Say, for example, if you want to warm up yourself, you can. If you want to slow down yourself, you can. It is like a toolbox. I always mention people that breathing exercises could be done in many different styles and fashions, and how you can bring your mindfulness to it, and you can tailor it depending upon what you want to tell your mind, having an intention. It also can, kind of taken along with your belief system. It doesn't have to be that one system to follow. So it is very accessible. It is modifiable to your needs, physical and emotional needs, or spiritual needs too. That's where I like breathing exercises a lot. And so with that, I would like to start the exercises. And some of the indications that I would like to mention, the contraindications specifically. So you know your body the best, and I am not able to see you. I'm not able to diagnose or anything. So if I'm teaching an exercise, if it is kind of, try it at a kind of low, medium paces before you get into the fast pace. If you have any discomfort during the practice, stop the exercise, continue with normal breathing. And you know your body the best, so see how each exercise might fit you. And if you have questions, please consult with your doctor whether this exercise is okay, doable. And if there is any active symptom, like very strong shortness of breath, during those times, avoid doing the breathing exercises, especially the fast breathing exercises. Okay, with that, let's kind of dive into some of the breathing practices. I'll take a little pause. Maybe if there are any questions at this time, please let me know before we move into practice. And during practice, I know you will have questions about the practice. Please feel free to let me know, because sometimes we may not know how to do this and how to hold the hand, or how to close the nostrils, which nostril, timing, all those things might be, you may have questions about. Okay, so Let's go ahead and sit in a comfortable position. I'm using a chair right now, so use a backrest or sit up straight, whatever makes you feel comfortable. If you like, gently close your eyes and bring your awareness to the tip of the nostrils without changing anything to the breathing. We watch the breathing, how it moves in and out. This is our normal breathing. It may be shallow, maybe fast, maybe stressful. Bring the awareness to the exhaled air as the air goes out. You may feel it a little bit warmer than the inhaled air. Try to follow the path of your breathing from the tip of the nostrils. Where do we follow? Is it to the forehead, top of the head, or throat, chest, abdomen, wherever it is? Watch the movement of the eyeballs, even with the closed eyes. How does it move with our breathing, inhalation and exhalation? Try to watch the middle of the forehead as we inhale and exhale. It may be a soft, shallow inhalation, exhalation, that's fine. Watch the junction between the inhalation and exhalation. We learn to watch the minute sensations attached to the breathing. The more we watch the breathing, the more we will watch the mind. The mind and the breath are bound together. Cultivating, watching, or taming the breath will also do so the mind. Now gently engage in deeper exhalation. Breathe out through the nose. Gently tuck the tummy in to breathe out completely and slowly allow the breathing to go back in. As we inhale, the abdomen expands, then the lower ribs, upper chest, and once more, just the whole torso from top to bottom, expanding it to a comfortable level. And then exhale, releasing the upper chest, lower ribs, and the tummy. Try to engage the tummy as much as possible, making sure that it is tucked in as you breathe out gently. Normally, we do not engage in deeper exhalations. The more the exhalation, the better the breathing gets. It's a good way to exercise the abdominal diaphragm. The more we are able to contract that diaphragm, the better will be the signal for relaxation. Slow, deep inhalation and complete exhalation through the nose. Closely observing the movement of the tummy, the lower ribs, and upper chest, all the way to the collarbone, and follow the sensation of complete inhalation flowing also on top of our chest, maybe all the way to the top of the head. At the top of our inhalation, we may be able to be aware of the forehead or top of the head too. And in the same way, at complete exhalation, when we tuck the tummy in, we may be able to generate the sensation of the pelvic floor. Imagine the breathing is moving along the spine from tailbone to the top of the head. Very slowly and deeply. Our mind travels up and down with the breath. If the mind moves away, bring it back, put it on the path of breathing. Along the spine, from the tip of the tailbone to the top of the head, slow, deep breathing in and out. It's also possible to bring in a sound as you breathe in and out. The sound is not produced externally. We just think about the sound. We don't make the sound. It's not vocalized. Just think about a sound as you inhale, a sound as you exhale. For example, a sound of maybe hum. Just to think about the sound hum as you inhale from bottom to top. And as you exhale, think about the sound sum as you exhale from top to bottom. This is a little tool for the mind to attach to. The mind will glue to the sound and to the breath. You can choose any sound that you like. So be finding it very interesting that the longer you chant within yourself, the longer you extend the sound, the longer becomes the breath. Now let's try another trick. We inhale in the same slow fashion, maybe or maybe not, just allowing a chant as you inhale. But when we exhale, we really produce a sound of humming. Right? We inhale and exhale with the humming. Taking the tummy in to exhale completely with the humming, and then slow, deep inhalation. And humming out. The humming can be any short, any long. Just follow your own pace. Inhale, hum out. Inhale, hum out. Again, the key is to tuck the tummy in, to breathe out completely by humming, and then full inhalation. Slowly come back to normal breathing and watch the breathing. When we watch this time, notice if there is any change in the way that you perceive the movement of the breath. How was it at the beginning and how is it now? Where do we feel the movement of the breath? You can slowly open your eyes. So connecting the breath, extending the breath, watching the breath. So these are some of the important exercises that we did just now. So how we are able to follow the breathing, normal breathing, and then extending it, bringing the mind to the path of our breathing, and then also connecting it with some sound, sound that is internally produced, sound um, that is externally produced, right? So I have a question. So it's for bronchiectasis patients. Is breath holding more of a challenge versus those normal bronchi? Is closed mouth breathing best for CO2 O2 balance? How do you keep from falling asleep, right? So if you're falling asleep, it's good. Just take a nap, come back and try the breathing exercises because the body needs it, and the relaxation response is bringing you that this sleeping sensation. That's totally fine. We all go through that when our body is tired. We feel sleepy. So the other thing is that the previous question. So if you want to open your mouth and breathe in or out, that is totally fine because during those conditions, you do not want to exacerbate and you want to just, the exhalation needs to be really important, like make sure that you are able to exhale, take in enough CO2. So any change that happens in the oxygen CO2 balance during the exercise is very transient and the body will come back to its acid-base balance. All right, so the more you are able to exhale, the better it is for the relaxation response, right? The coughing, again, humming is a great way to kind of reduce that coughing. Extending the breathing is not always easy, but it can be slowly trained from, the coughing is also stimulated with dry mouth, dry throat, right? So with these breathing exercises, you'll be able to create that the smooth or the lubricated feeling with the mucosal proteins. We even found proteins like mucin that are secreted more. With the humming, you'll be able to secrete more of the saliva, more moisture. It reduces coughing as well. So it is a slow process. It's completely a slow process. Um, Finding that right balance, doing it for 1 minute, 2 minutes, and then slowly increasing that time. It's taking it very, very small steps, one step at a time, right? So
Sundar, sorry, I wanted to ask a quick question because I was curious about this. So with our patients, a lot of times when they are doing airway clearance, they're coughing to expectorate to bring up mucus. So have you looked at any of this yogic breathing, to help with the airway clearance part? And is there maybe the potential to be able to use this sort of in both respects, sort of first to help with, maybe with the humming to help with the vibration,
yes.
perhaps, and
So
then to help calm the coughing afterwards? Is that something that can be looked at?
Yes, definitely. There are no previous studies, especially with humming, but there is a lot of anecdotal evidence that how it is good in. There was one case report on how the person was using humming for sinusitis, chronic sinusitis. But with the coughing, we'll be able to mainly because of the production of the salivation, not necessarily the mucosal, like the vibration would also be helping in airway clearance too. So it is a possibility, but there are no clinical evidence for this practice. This is one of the easiest good practices too, because it produces nitric oxide from the sinuses, releases it. It is also a good bronchodilator, vasodilator, so also a neurotransmitter. So it's a good practice to try it. But unfortunately, we don't have any clinical trial based evidence for this. Yeah, try it.
Okay.
If it is not any doing any harm, you probably are doing good to your system with this exercise. Yeah.
Okay. We have an interesting question. Somebody says, I felt my body warm up during the breathing exercise. Why does that happen?
Yeah, it is. But it could be. There are many reasons, right? So the body could be, the main thing is that how it impacts our circulation, right? So the carbon dioxide is a key regulator of our vasculature, right? So the vasculature is improved, or circulation is improved when the carbon dioxide level rises a little bit, very slightly. So during breath hold practices, our circulation also is improved. So this nice deeper breathing, deeper inhalation, exhalations improves the circulation. That is the sensation that you probably are feeling. And also the mindfulness, right? So when you are breathing in and out, when I'm saying that, watch the breathing, sensation of breathing all over your body. That is also a way to connect your mindfulness throughout your system. So that also can improve the changes in temperature. Sometimes some people feel that nice and cool experience, nice and warm experience, tingling, right? Sometimes when we do the fast breathing exercises, have the fingertips having the tingling experience. So these are all interoceptive signals, very strong signals about that are related to the movement of the breath that can be perceived in our body. It's not an imagination. So this is where the mind also is turned inward. The interoception, it's a great way to reduce stress.
And we actually have somebody who commented that she says, I noticed that this short practice even assisted with airway clearance as I was doing the practice. She says she was surprised by it. But I guess breath work is going to be helpful in a number of ways. So I think that's probably a plus either way, whether it helps calm your coughing afterwards or whether it helps with your airway clearance so that you cough more up, it's probably a plus,
Yes,
um, you know,
definitely.
either
Humming
way.
is one of the very easiest exercises in the practice. It can be done with the many different postures also, but I recommend humming in all the activities when you're walking or when you're doing your chores or sitting on the computer. Most of the time when we are working on our screens, we don't exhale properly. So the humming, time to time, we also have an app called Humma, Humma. It is a free downloadable app on Apple iPhone, Android. So this helps basically to extend our exhalation with the sound. So that's all it is. You can hum a chant, you can hum your favorite song, and you can hum while you're driving, keeping your eyes open. It's very easy and portable practice. So humming all day is probably a good idea too. So if you're comfortable, hum all the time. Yeah.
We have a question. Why is breathing through the nose more important?
Yeah, so the mouth breathing is also possible, and sometimes we do when we want to inhale more or exhale more. But we want to engage our nostrils because the nasal system is connected to specifically the olfactory bulb neurons here, and these neuronal structures are integrated with our brain. So the brain is constantly watching our breathing. So our five senses are collecting information. Apart from those five senses, breathing is the sense that the brain is constantly watching 24/7. The way that we breathe, the brain is going to act accordingly. So the breathing, we breathe about 15 times a minute on an average normally. It may be less or more. Normally, it is on the faster side and shallower side. So when we extend our breathing, the slower breathing, 6 times a minute or 7 times a minute, or even lower breathing rate, will help the brain to understand that we are not stressed, and our improvement of our memory or attention, these are all improved. This is shown in other experiments in animal models also. So it's very important to watch the breathing. If you're breathing fast, slow it down, take deeper breaths. That's what it is important for. And also you know about the how the air is getting conditioned. So through the capillaries, it is getting warmer. So the warm air goes to the lungs. And then also it is filtered. So there are so many advantages. The brain connection is the key. And then it also is like important in regulating, like filtering the dust particles and warming the air or cooling the air, all those things. Yeah.
Okay, we have somebody asking, how can we incorporate these breathing techniques while we nebulize medicine or hypertonic saline? It would require mouth breathing instead of nose breathing. Would it work the same?
Yeah, so you have to, when you're using nebulizer, yes, definitely you have to use the mouth breathing. But after that, once you're finished with that, then, kind of train your system to breathe through the nose. So whenever it is possible, breathe through the nose. That's what my recommendation is.
Okay. Somebody commented to exhale, I had to do pursed breathing, but it worked well. And they said they also need to practice inhalation to fill the stomach as it was challenging, which it probably does require regular practice you know, to get
Ob-
better at all of it.
Obviously, yeah, regular practice is always important. And then pursed lip breathing can be a little bit of a challenge because you're not exhaling fully, right? So you're kind of restricting that exhalation. So the exhalation is longer. That's okay. If you're able to tolerate that, do it. If not, the humming is like a free flow of exhalation. So you can try both of these exercises as well.
Okay, we have a couple questions that are kind of related. Somebody's asking, can you do this breathing too little or too much per day? Is there an ideal length to try breathing exercises, particularly the humming part? And then somebody else is asking, how often should we strive to do this practice? They also wanted to know the name of the app. You said the name of the app was Humma, Humma, correct?
Yes, it is.
Okay, so
Yeah.
so can you talk about how long they should do it, how often they should do it?
Honestly, there's this the case report that I was referring to. This person was humming for 4 or 5 days, like continuously, a lot, almost the whole day, right? So there is something that I can say that it is not, there's no adverse events. In many studies that we did, or in all of the studies that we did so far, there are no adverse events in cancer patients or patients with the scleroderma, patients with aging conditions. So the most important thing is that your body will know, like when you are kind of going across the boundaries, right? But here there's no specific way that you can say that this is too much of humming, right? You probably have like I don't even know what type of overdose the humming could do, right? You probably overjoyed with humming your favorite tune, right? So there just watch if you're feeling okay. That's totally enough, right? That much of humming you can do. Uh, you won't be able to do that for longer than like 15-20 minutes. You will normally casually take a break and then you will restart. So I would recommend that every hour, at least start with a minimum of 5 minutes to 10 minutes. So you can even use a timer that the Humma app has a timer. Every hour you hum for 5 to 10 minutes. That's a great way to start. And if you're but the humming can also be like if you hum at a very high pitch, right? That also could be a little bit of, kind of, I would say, psychologically, it might put you in a hyper amped mood. So keep it low or medium level of the pitch. Not so that might also like would stimulate you more. Did
We have a follow-up comment from before. She's noted that it was easier to fill her stomach than it was to pull it out, to pull it in while she was exhaling. So that's, I think, probably good information to know. Some people may find that easier, and I think it's important to know. Somebody's asking, do you have any experience with Tulsi and lung health, especially with NTM and bronchiectasis? I'm not sure what they're referring to, but you probably do.
Yeah, it's like a basil, a holy basil plant, and I don't have much information. I know anecdotally that people take many different herbal preparations. Tulsi is one of them. Definitely, if it helps, I'm not sure. I wouldn't say anything that I'm not, kind of having data on. Right?
Yeah.
People
And
do a lot of herbal preparations, tulsi, ginseng, green tea with honey, ginger and lemon with honey. These are all great, supplements that people can try, but I won't be able to recommend any of those
and
because I don't have data.
And as a reminder, if you're using any supplements, you should make sure to tell your doctor and your pharmacist in case there are any interactions or
Exactly.
contraindications with your medications that are treating your
Exactly.
NTM or your bronchiectasis.
Mhm, mhm.
Is the humming the same as I don't know if I'm going to butcher this very much.
Ujjayi breathing. No.
Ujjayi breathing.
So
Okay.
Ujjayi breathing is basically sighing. So humming is a different exercise. It's called the Brahmari breathing. Ujjayi is the sighing breath or ocean sound breathing. We can try Ujjayi also, so you will know the distinction between those two. So those somebody was talking about the you know sleepiness when they are doing the exercise. This exercise will help us to take deeper rest, right? Whether we are before going to bed or in the middle of the night, we get up and then it's hard to go back to sleep. Those times we'll be able to do this exercise, the ocean sound breathing exercise, as a way of a feedback to our system, like how is my breathing? So we can follow that ocean sounds. It's nothing but like creating a sound like Darth Vader's breath, right? But with a closed mouth, engaging the same area to create that sound. It's also a restrictive breathing between the upper and lower respiratory tract. So you'll be able to create that sound and follow the breathing. It'll be something like this. So inhalation and exhalation with the same sound, like the constriction of the epiglottis. So this creates a sound. The sound is the feedback, like the ocean sound. It also is a good way to improve the restriction between the upper and lower respiratory tract. If it is not comfortable, don't do that exercise because it's a restrictive exercise, slows down further, like the pursed lip exhalation. So do it at your own pace when you are feeling comfortable. Okay. So
We have
do
another question in the Q&A. Is there any reason why we shouldn't do this breathing while lying down?
No, you can do that lying down. You can do these exercises lying down, finding a comfortable pace. Some people have the, reverse breathing. So instead of when you breathe in, instead of the tummy moves up, the tummy will go down. That's because of the stressful inhalation, right? So sometimes we do that. We train our system with the shortness of breath. We inhale when the tummy moves in. So to do that consciously, lying down and then following the movement of the tummy and the chest is a good practice too. So be comfortable, whatever makes you feel comfortable, do it. Sometimes sitting up is much easier on the breathing side, doing the deeper breathing exercises, right? So now I would like to show some more exercises. Is that okay? right? So keep
Absolutely.
your questions and then we'll address them, right? The next exercise is I was talking about the olfactory bulb neurons here, right? We have the nasal cycle. Sometimes our left is more open, sometimes our right is more open. This is the way that the system is turning on and off or keeping a balance, keeping a rhythm. This is one of like our circadian rhythm. This is an ultradian rhythm, smaller rhythm that helps our brain to kind of use the two hemispheres in a specific manner. So there are a lot of newer research coming up. It is not completely understood, but in the yoga tradition, we call the left nostril as the cooling one, the moon, the right nostril as the warming one, the sun. So we balance these two as a way of keeping that nasal cycle on and off, or keeping the nasal cycle balanced or moving, right? So in this exercise, what we do is we close one nostril, slowly inhale, and close the other one and slowly exhale. So you can use the hands or fingers in any style you like use the thumb and the index finger, use the thumb or the two fingers like that. So either style is fine. So just close one nostril, slowly inhale, close that and exhale on this side. And after exhalation, breathe in here. Switch the nostril, exhale. So it goes in, out, just alternating. And during this process, just follow what happens. Which side is more open? Which side is flowing freely? The other one is a little bit constricted. And how do my eyeballs move in the direction of our breathing? And what do I feel inside? So forget whatever happens in the chest or the tummy area. Just focus on the head and the face, like in the cheeks, middle of the eyebrows, in the deep inside my forehead, deep inside of the head, or earlobes. What are all the sensations that I can follow through my breathing, through individual nostrils, at different stages of inhalation and exhalation? It's a big drama that goes on. It's a very sharp way to pull your mind inward and follow what's going on, right? It's a very nice exercise. Try it and feel comfortable. If you had to take it faster, that's okay, but try to be as slow as you can. If your one nostril is completely blocked, you won't be able to try this at this time. And after some time, when the two nostrils are slightly opened, then you can try. You can you can try just by mentally as if you're breathing through alternate nostrils. If you have any discomfort, stop the exercise, continue with normal breathing. The exercise is known to improve the hand-head coordination, the clarity or balance. After the exhalation, come to normal breathing and watch the breathing. And any change in the way that you sense the movement of the breath. In the place where you are able to feel the movement of the breath, you can put your mind and breath there. That's a restful place. That's our internal home. Open your eyes. So
Okay,
this,
we have a question.
sure.
Somebody's asking, I was taught that method with holding the breath at the top of the inhale. Is there any benefit to that?
Next exercise. We are doing it. Yeah.
Okay, let's get to it.
Good. So this the one that we did is a very calming, very balancing, right? So the exercise, I would also say that this one can be done for up to 25 minutes, 25 minutes. If you're feeling comfortable, you can do all the way up to 25 minutes, right? So the previous exercise, also you can think that either it is humming or deeper breathing exercise, have that maybe 25 minutes as your limit, right? If you're comfortable, you can do longer, but 20, 25 would be the limit, I would suggest. Okay. And there's a good segue. That question was a segue to the next exercise where there is a breath hold. I talked about the carbon dioxide as a good signal for improving our circulation. The exercise that we are going to do has a breath hold. Again, approach this very cautiously as per your comfort level. So this is the exercise that we use in many of our studies in cancer patients and caregivers and in scleroderma as well. So here there is an inhalation through the left nostril, only through the left nostril. We do that because I mentioned that it is the moon or the cooling side. It is supposedly the relaxing side. So the relaxation side is for inhalation. So the inhalation, you can do it in two different ways. The easiest way is to inhale fully as much as you can comfortably, right? The other one is the counted manner, like inhale for 2 counts of any chant inside your head, I'm powerful, I'm beautiful, right? Though something that you say to yourself twice, that's the time length of your inhalation. So if you say, that's a deep inhalation from all the way from bottom to top, right? That's the inhalation timing. Then hold the breath for 8 counts. I know it's very challenging, but what I'm saying is inhale, hold as long as you can. It doesn't have to be 8 counts. It can be 3 counts, 4 counts, whatever may be that's comfortable for you. After the breath hold, open the right nostril, breathe out completely or for 4 counts. So if you like to follow the counts are 2 for inhalation, 8 for holding, 4 for exhalation, complete exhalation, taking the tummy in, and come back to inhale through the left. Always in through the left, hold out through the right. Repeat it, right? If you do not want to follow any of the timing, inhale fully, hold as long as you can, exhale completely, repeat, right? Can we try it for a few rounds? And then we'll take a break and come back. If there are any questions, we'll address the questions and then go back to the practice, like maybe 5 minutes, right? So let's try that. I follow the timing, just counting, just to show you. If not, you follow what you like. Once you finish an exhalation, come to normal breathing. And if there are any questions about the exercise, let me know. If not, let's continue for another few minutes. At the end of exhalation, come to normal breathing and watch the breathing. Again, we are completely becoming aware of the quality of the breath, the depth, the sensations around inhalation and the exhalation, the places where we are able to follow the breath. Every breathing exercise or the pattern has the ability to impact the sensations, the interoceptive signals, and our mind can follow it, and mind can be regulated along with it. So it's a powerful way to cultivate the mind as well. You can open your eyes. And the questions. Yes, we breathe out through the right nostril. So inhale through the left, hold, and exhale through the right. You try to get deep breath just comfortably, what you can inhale onto. So my goal during inhalation is complete inhalation as much as I can. Just full inhalation. If I'm not following counts, that's what I'm doing, inhaling to the fullest. If I'm following the count, I completely inhale within that count. Alternate in breathing, breaths left and right, or always breathe in on the left, right, and exhale on the right side. Yeah, so in this exercise, we always follow unidirection, in through left, out through right. Even if you do it in the opposite direction, there may be some feeling of maybe it will warm you up rather than cool you down. That's needed sometimes too. So you can watch how you feel with the different patterns, right? So that's why this is kind of a tool. You can try different tools and see what works best for you. Okay. There's no one size fits all. Right? Great. Awesome.
So,
As
sorry, we have a couple questions. I think you've been going through them. Oh,
yes,
okay,
yeah,
I'll leave you to it.
very good. Yeah, I saw those questions, and then um, there are many. So main purpose of alternate nostril breathing, as you mentioned, that's a way that the nasal cycle is um, regulated. So sometimes we breathe largely through the left. Sometimes we breathe largely through the right. So this alternate pattern is important for many biological functions, especially for the nervous system, and obviously circulation, metabolic activities. These are all connected. It's not fully understood in the neuroscience. So the nasal cycle is a very new topic for us to study. So in the yoga tradition, this particular alternate breathing exercise is kind of balancing. So that's why we try that.
Okay.
Right. And then there are several exercises, as I mentioned, my book on 37 exercises, another book, Breathe a Little Better. They have many practices. You can try them. Whatever makes you feel comfortable, you can hang on to that practice and continuously do. Is there any reasons not to do this before bed, or is it good to do before bed, right? So there are some exercises, especially the fast breathing exercises, maybe warming you up, like energize you, activates you before going to bed. It may be a little bit difficult to sleep, right? So that's why the fast breathing exercises are not good just before going to bed, but they are great if you like maybe 2 hours before going to bed, right? And slow breathing exercises will help you to calm down, get into sleep in a very meditative way. So the slow breathing exercises are good just before going to bed, right? Turning off everything and then just watching the breathing, taking a few the ocean sound breathing, the Ujjayi breath is great, or just a slow deep breathing with the sound inside or outside. This also be a good practice before going to bed. 2 hours before going to bed, you can do some fast breathing exercises, deeper inhalation, exhalation in a faster manner, stepwise breathing exercises, breath hold practices if are good for you. So try them a little bit earlier to the bedtime. Okay.
After this exercise, my heart was beating harder. Is that good or bad? Is one of the questions in here.
So it might improve the circulation, might improve it. So that's why your maybe the heartbeat is going up. Well, another reason is that our breath hold, right? So the breath hold also might activate that faster heartbeat. So just to maintain a balance, right? Don't go overboard, just to slowly build it up so you will feel comfortable. Like if you're doing the exercise for 20, 25 minutes, have that kind of a slow, active circulation going on. Do not exacerbate yourself. Yeah. This is like, it's a way of improving the circulation. If you feel more moisture with any of the breathing exercises that we tried today, there's more moisture in your mouth, in your eyes. That's an indication that your body is responding to the practice. It is good to hang on to that practice and doing it more.
Okay. I'm seeing three open questions. I don't know if you already went through these. There's the question about breathing through like,
Yeah, I did. I did
okay,
those three
great.
questions. So we
All
inhale
right.
through the left, hold it, exhale through the right. Yes. Okay.
Okay. And then
Yeah, I
you
got
reverse.
that too.
Okay, great. All right. So everyone, this is your last chance to drop in a question. If not, thank you all for attending. We are very pleased that we were able to bring this to you. Thank you very much, Sundar. This was great.
Yeah.
Another topic that people have been very interested in, and I think, there's starting to be a little bit more research in the area, and, yours among them. So thank you again for sharing this information with us. Oh, hang on, we have more. How is the 2-8-4 breathing different from this 4-7-8 breathing
Yeah. So
that's taught?
you can try all different practices. Whatever works good for you, you can try. The 4-7-8 breathing is through both nostrils, right? So you'll be inhaling, holding, exhaling. The exhalation is nice and pronounced. In the 2-4-8, 2-8-4 breathing, the one that we did, it is the nostril specific. And then also the holding is the longest period of time. It also is like kind of a faster exhalation. So you are inhaling and exhaling in a slightly faster manner and then holding the breath for a longer time. So this is the one from the yoga tradition that we used for our clinical trials. This is the one that we showed. There is an induction of proteins responsible for the improvement of the nervous system, circulation, immune system, and also reduction in inflammatory signals. The other thing is that we haven't published the newer data on molecules that would be helpful in addressing fatigue, like how you will be able to be energized. So when we do these breathing exercises, we produce molecules that will feed into that higher energy level, right? So you'll be able to be energetic. It is a great connection for us to link it to fatigue. That's what we are working on currently. So the 2-8-4 is the breathing exercise that we have generated more evidence for.
Okay. We have actually a couple of questions now that are so first of all, somebody's asking if this is going to be available later to watch and practice. Yes, this will be available online, and we will be emailing everybody who registered as soon as it is available. And also the titles of your books. You mentioned that you have a bunch of titles that you have published.
Yeah,
So if you want to go ahead and list some of those titles, but probably also we will want to get those titles from you so
yeah.
we can go ahead and send those out as
They're
well.
all available on Amazon. So
Oh,
my
great.
just even if you put my name and Google it, you'll find that. I
Ah,
definitely
perfect.
don't, I'm not making this as a forum for selling my books, but the 37 exercises are in the first book I typed in there, Mind Your Breathing. It has many different 37 exercises from the tradition and then the, kind of the modified practices too. So the other one, Breathe a Little Better, is connected to some of the concepts, say concepts of gratitude, mindful eating, resilience. Those are the topics that we have, concepts that are connected to breathing exercises. So 50 different breathing exercises. You can take one per week for the whole year. Yeah.
That's great. Thank you so much. All right. So yes, we will make sure that people get the links to those as well so that they can also find your books. Everybody, we are past the hour. Sundar, thank you so much for giving your time to us today. This was wonderful. People seem to really appreciate it. I know I did. Everybody, be mindful and go practice your breathing. And we will see you again at our next World NTM Day webinar. Thank you so much.
Very good. It's a great opportunity to be here with you all today. And thank you, Amy and Helga, for making this connection. I will send a questionnaire, as I mentioned before. So this
Great.
will be working on a PCORI grant where the community's participation is very, very important. And we look
Wonderful. We are always happy to help with the research that our centers of excellence do. So we are looking forward to that as well. Thank you so
super.
much.
Thank you all. Have a good day. Bye bye.
Everybody, thank you so much. We'll see you again soon.